Hello everyone, welcome back to the channel. I know. Sorry, it's been quite a while since I uploaded the last video. I've been not only in quarantine as many of you, but also I've been working here and there in terms of my rotations and everything. So apologies for the delay. So kind of an update in terms of what last video went. After the hospital that we were to in New Orleans, we were transferred to a different hospital, basically the main hospital of that area. It was UMC. So over there was a very fruitful experience in terms of getting to understand what the protocols over there were in terms of treating the COVID patients. Very ill patients, stable patients, success story patients. We saw a significant array of different experience over there. Definitely there were certain things that we learned and grasped to be able to bring over here to Shreveport on our hospital to be able to implement with all the patients that we have over here. Also throughout this week, as I mentioned, I've been kind of here and there working in my rotations as well, kind of working from home. And one of the concerns as to why I was precisely in quarantine was because I went to New Orleans and we were in contact with a lot of the sick patients. I've kind of developed a cough for about a week or so. However, my program wanted me to get tested. I went to get tested, and fortunately and thankfully the result came back negative. So that's certainly a very big relief for us. And so kind of the next step for me in my rotations is that today I start the night float. In other words, just kind of the third shift or the overnight shift, taking care of patients anywhere from regular patients that might be in the hospital, as well as COVID patients if they're in the hospital. And based on kind of the experience that I got, I really want to share a couple of points that were the most significant for not only us but also for me that I was able to kind of grasp based on that New Orleans experience of about almost 2 weeks. So the first thing is that despite us healthcare providers being the front lines, we are nothing without you, in the sense that we might be taking care of sick patients. However, the appearance of sick patients or the amount of sick patients that present to the ED and of COVID patients depends entirely on you. You are the front lines. You are the ones that are right and left hands and for all the healthcare workers, because if it's not following those physical distancing and social distancing recommendations, then we would be in a very different position. So I really want to thank you, each and every single one who has helped in this process. And we stayed at home, and I know this is a marathon, and that has been a very difficult time for everyone. But from a healthcare worker, I want to extend my gratitude and thankfulness for every single one of you that has helped us help you, as I've always said. So the other thing is that there have been some arguments kind of going back and forth, not only among healthcare professionals, but also in terms of the general public, that this virus doesn't discriminate, and some say that it kind of affects more a particular population or not. Honestly, I kind of lay more on the argument or the point that this virus still doesn't discriminate. Reason why I say this is because different physicians and in social platforms and everything are from different countries, they show their demographics are different, and every country has different demographics, different populations, different diseases that are more prevalent than others. And although in some countries it affects the sector more than others, based on the experience that I had in New Orleans, I still am along with the fact that this virus does not discriminate. I've seen 20-some, 30-some intubated in the ICU, 70-some with all the diseases in the world that have mild disease or any symptoms at all, and 20-some-year-olds requiring oxygen, as on the videos that I mentioned before. So at least in the United States, it has been very varied and very broad, the population that this virus has affected. another point that I kind of want to bring up as a learning experience is that the mortality rate, it's been incredibly varied in terms of every country: Italy, Spain, France, Germany, United States, China. Every single country has had a widely different mortality rate, and mortality rate of the disease mostly occurs, and it's usually if the disease progresses to severe kind of case. And however, this mortality rate, despite being around 10 to 12 maybe in Italy to kind of 4% here in the United States or so, the overall mortality in the world has still not kind of reached the 5% or so. So I am not saying that this virus is not concerning. On the contrary, it's something new, and it's something that is definitely very dangerous, because as we've seen and we've described before. The other thing is that this virus, we've seen that it spreads without a person having any symptoms. So I do encourage every single one of you to continue wearing the masks, the cloth masks, to be specific. Continue leaving the as much as possible the respirators, the N95s, as well as the surgical masks to the healthcare professionals, please. But I do continue to encourage social distancing, as well as continue to wearing the mask whenever you go outside. If you feel sick, stay at home, quarantine. If you need to go out, go out. If you need to, if you absolutely need to. Which kind of brings me to my second point: because most of the United States has been, and most of the population in the United States has adhered to these social distancing guidelines and recommendations and using masks, we are seeing a downturn on that famous curve. However, I want to emphasize that we cannot slack off. We cannot just forget about these rules, because this is a marathon. This is not a race of speed. So I do continue to encourage to continue adhering to the recommendations of social distancing, limiting gatherings, staying at home, wearing a mask, as I mentioned before. Because if we don't, we can potentially get into a second wave, and we would technically be kind of starting all over again, unfortunately. So let's continue working together and continue getting that downtrend curve, which again, I can understand that this is a complete shift in terms of everyone's lifestyle, including healthcare providers and every single one in every single country in the world. This is a new norm, a new kind of lifestyle that we've have to gotten used to, and not gonna lie, it's difficult. It's difficult to adjust every single aspect of your life, staying at home, only going out if necessary, and if you absolutely need to, not having that person-to-person close interaction like many of us, especially for example me, who comes from a Hispanic origin, that we're used to kisses and hugs and everything, and it certainly is difficult. I can completely agree with that, but again, it's a marathon, and it's kind of a new norm that if we want to be able to get out of this, we need to continue working together. Which brings me to another point. Thus far, there are no approved treatments. There is no known treatment, and the vaccine is, well, quite a few years away still. Thus far, there is no cure. Thus far, and the data we have in terms of treatment, then it's still in the works. It's still in the process. We're still discovering things, and I know that it's not the best answer anyone wants to hear, because we all want to know how we can deal with this, how we can treat this, how we can cure this. Thus far, I know, again, this is not the most encouraging answer, but the best treatment for this is prevention. The best management for this thus far is staying 6 feet apart at least, social distancing, preventing and getting the virus. Why? Yes, a lot of people will be asymptomatic or have just a mild disease or just a mild infection, but that doesn't mean that's going to go the same way for everyone. And since we don't know, who will potentially end up in the ICU or get worse from this disease, we want to avoid exposing the most people as we can. So please continue adhering to the different guidelines, please. And I know this has been kind of a video in which it's more adhere to the guidelines, social distancing, stay at home, kind of nothing changed from the past multiple weeks. This has brought a lot of distraught, a lot of stress, frustration, fear, anger, and I acknowledge every single one of those. And I, in a sense, can relate how these feelings come about, because as a healthcare worker as well, we take care of patients and we want them to get better. We want them to improve. And not being able to have a concrete answer and just starting to know this, it does give a sense of powerlessness, not gonna lie. So I understand why it can be a little bit difficult for general public to grasp the magnitude of the issue right now. And I understand why they can get frustrated and why you can get anxious and fearful. To that I say, let's keep together, but separate. We're on this together. We might not be in the same boat because everyone's reality is different. So I know some people might be going through hardships, and this is not the best time, and there are a lot of people who might be losing their homes, are not earning enough income because of the situation. So I can definitely understand or empathize with how these situations have affected every single one. And so, although I can't understand, we also have to try to look at a little bit more forward ahead, in the sense of if we break the prevention measures as of now, we can again go back a couple steps, and that is not good for anyone either. I understand how it can be a tough situation for a lot of people, and we need to stay together still. Again, I know these are not necessarily the answers anyone wants to hear, but these are the answers that so far are available. And finally, regarding a concern, is that another lesson, and it's something additional that I noticed, was that people are putting off real emergencies because of the fear. I can understand definitely the fear, but if you or a loved one or anyone you know has an actual emergency, has chest pains, has suspicious for a heart attack, has issues, is diabetic, has an issue with insulin, or any other sort of actual emergency, please come to the emergency department. We'll take care of you. The emergency departments are not only COVID. The emergency departments are still emergency departments. So we will take care of you. Anything that comes in. I know that there's this fear of getting infected with COVID, but we will do anything and everything we can to be able to not only take care of you, but also protect you. So please, I encourage every single person who has or experiences an emergency, an issue that is potentially life-threatening, to come to the ED. I know there's that fear, but your life is worth more. Please, we still encourage you. Come, we'll take care of you. And as always, I thank you for sticking out up until the end of the video. Again, these are just kind of thoughts and part of the vlog of this COVID journey so far. Now back in Shreveport, going again to my rotations. I'll keep you updated as often as I can, especially now that I'm formally restarting my rotations. But nonetheless, I will see you in the next video. This is all for today, and if you like this video, please leave a like, and until next time, I wish you a happy and healthy life.